Hello, this is Katie Martling reporting on teamwork and patient-centered care, the SBAR Communication tool. SBAR is an acronym for Situation, Background, Assessment, and Recommendation. Situation. You clearly and briefly define the situation. You give a concise statement of the problem. Background. Provide clear, relevant information, pertinent information about the patient's name, the diagnosis, vital signs, and medications. Assessment. What you found. Your professional conclusion. Recommendation. What do you need from the provider for the patient? The action that you are requesting. SBAR is a communication technique and tool for nurses to be used to facilitate prompt, accurate, and appropriate communication. It provides a framework for communication between team members of the healthcare team about a patient's condition that promotes a culture of safety. In my case scenario, I am presenting a patient of Dr. Mann who has arrived in the pre-op holding area for a cystoscopy and ureteral stent placement for hydronephrosis. He has a history of metastatic colon cancer. Upon assessment, he reports shortness of breath for 3 days and is found to have absent breath sounds on the right. My preoperative assessment would go something like this. Good morning. My name is Katie. I'm a registered nurse and I'm going to be taking care of you while you're in the operating room. I need to check your name band. If you'll please say your full name out loud and your date of birth. Are you allergic to anything? You haven't had anything to eat or drink since midnight, correct? And in your very own words, what is Dr. Mann going to do today? Has there been any changes in your health condition since you've last seen the doctor? You've been short of breath? I'm going to listen to your lungs with my stethoscope. Upon listening, I hear clear breath sounds on the left and absent on the right. This is going to require a phone call to the doctor to give an update on the patient assessment. The doctor phone call would go something like this. Yes, hello, Dr. Mann? This is Katie. I am taking care of Mr. Miles. He's a patient of yours, an 84-year-old male today, here for a right ureteral stent placement for hydronephrosis. He has metastatic colon cancer. He stated a new onset of shortness of breath for 3 days. Breath sounds on the left are clear, and on the right they are absent throughout. I think we need to put his case on hold, have the anesthesiologist and yourself come and do an assessment, get a chest x-ray, and a pulmonary consult. Okay, yes, I will put those orders in. I'm going to read them back. Chest x-ray and pulmonary consult. Thank you. The chest x-ray showed a complete pneumothorax on the right side. In critiquing this patient-centered scenario, the outcome definitely was great patient care. The patient had an unfortunate condition and did not become further harmed by an invasive procedure that could have resulted in a very poor outcome. The entire team collaborated and communicated, and the result was great patient care. Thank you.